Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, welcome to the Hair Loss Show, episode 27. My name is Dr. Vikram Jayaprakash.
I'm Dr. Russell Knudsen, welcome.
Right, so we feel that those of you who stayed with us, thank you very much for staying with us and watching all the videos. If you like them, please give us a like and subscribe. We've done a lot of sort of didactic talks on what the cause of hair loss is and treatment options and how to manage it both in men and women. I thought what we do today, what we try and do, is take a little bit more of a practical approach and do some case studies and see if that's of benefit to people.
So basically the message is what you're watching is typically how a consultation would work if someone came to see us, because we want to show you, I mean, there's a lot of information that we've already given you, but that doesn't necessarily mean that some of it's appropriate, some of it may be inappropriate. So basically the understanding of the concept is that when you come in for consultation, which is why it's difficult to do, people send us emails all the time and ask us for advice on what to do. If we don't have a clear view of what we're looking at, we can't customize the advice. So every patient that comes in to see us gives us a chance to examine the amount of hair loss, the quality of their hair, and then talk to them about what their goals are and whether they're realistic. So this is really an example of how we would walk you through consultation if you came to see us, so that you'd understand what your options were.
And I think also that's very true, and also hopefully we'll give you sort of a view from inside our thought process.
Thinking.
Yes, and how we'd approach it. So we're going to go through a patient. If you like that, please leave a comment. One other option that we've talked about, if people are interested in like this sort of format, if we can do more of that, of course, but if you're in the Melbourne area and want to take part of a live consult, we can do this in person with a person. And at the end of the video or in the description below, we'll leave a link of how to contact us to arrange that.
So it's obligation-free and cost-free, right? So if you wanted to come in and do it live on one of our web chats, then you get a free consultation as long as you're prepared to let people watch.
Absolutely. So the couple of things I want to talk about, this is how we would manage a patient from the beginning. A lot of people, when they're having a variety of different cosmetic surgery, they will say, I want to see your before and afters. This is not that sort of thing. We're not going to show you, oh look, this is what we started with, and this is the fantastic work, and this is the outcome. That's not the goal here. It's to say, right, we've got someone, how are we going to manage that? The second thing I'd like to say is that the photos that we're going to show are photos of patients of ours. All right, so bear that in mind. Hopefully from that you can get some information that may be appropriate in your case, but please be mindful that these are real life patients. So if you are going to leave comments, please be respectful on that front. Okay. All right, so we will, should we get started with this? All right, so we have a gentleman here. He's 36 years old. Okay. And he's noticed some hair loss when he was early 30s. Over the last 2 or 3 years, he's been reasonably stable, so he hasn't lost a significant amount of hair over the last 2 or 3 years, but he's not happy with the existing hairline that he's got and the density that he's got in his hair. He's not got he's not got a significant family history of hair loss there, but he's just generally not happy with what he's got. So he's come in to see us because he would want to make sure that his balding hair loss doesn't get any worse, but also what are his treatment option and management option plans that are possible for him. So I'll start off by saying, we've done the examination, we look at, we've assessed his hair. He's got, the back looks great, the top looks fine. He's got some miniaturization that's going on in that frontal area, in that frontal forelock as well. So I'm going to pass it on to you, get us started. How would you manage this?
Okay, so for those of you who understand the Norwood classification for male pattern balding, there are 8 versions of that. So basically this is a 2 heading towards a 3, okay, which is early. So the thing to remember about all men, 100% of men, is that they reshape their hairline by the end of puberty.
That's right.
Not much, but a little bit, right? And so Norwood 1 is probably at the upper limit of normal, with a little bit of reshaping involved in it. And once we get to 2 and 3, we're looking at recession in the temples. So if we have a look at this first photo, I'd say to you that my impression, without seeing the whole face, is that the height is still at the original height in the centre. So that's the first thing we notice.
So when we look at a hairline, you know, there's a whole part of it, but one of the first things we focus on is that lower bit, and we look at that ratio there. And for most people, that's a third. That area of the nose is a third, and the bottom part is a third as well.
And typically, it's about 7 centimetres from the middle of the eyebrow to that midline point, 7 centimetres. So that looks like the centre part is okay. There's obviously recession in the corners. And it's a curious fact of life, I don't know why, we see this all the time, that a lot of men recede a little bit more on the right before they recede on the left. It catches up later. It's a mystery to us why that occurs. But most of our patients have lost a bit more hair on the right by the time they come to see us than the left. And you can just kind of get the impression, it's pretty subtle here, but you can kind of get the impression that this is a bit deeper than this in this photo, and that's what we're talking about. But basically we're at the situation now in both these corners where if the patient said, look, I'm really not happy with the shape, I'm not happy with the recession. Number one, I'm not happy that it's asymmetrical now. It used to be symmetrical, it's now asymmetrical. I'm not happy with how much it dips back in the corner. What can we do? Well, the short answer is we don't want it to get worse, number one. So we start by discussing the medical options here. And what we're concentrating on is this, because this is gone, this is gone. There's nothing medical, tablet, lotion, laser, derma rolling, PRP, anything that's going to work in that area, okay? That's too far gone. But medical treatment is about keeping this tuft as strong as possible. So we would discuss the benefits of finasteride because that's the most effective thing we have in our armamentarium at the moment, finasteride tablets. Low dose finasteride to keep this. I mean, he doesn't have aggressive balding. Think about that, right? He's like, you know, puberty finishes at around about 17 or 18. He's 36.
36.
So this is 18 years on, right?
And he hasn't lost a significant part.
He hasn't lost a significant amount of hair. So he should be a very successful candidate for using medical therapy. So we would discuss the advantages of using finasteride to keep that and to stop that going back further and that going back further. And just to remind you, the figures for the first few years of finasteride use are better than 80% of people will stop receding. Because this is only mildly thin, that could technically, possibly thicken a little bit with finasteride as well. But out here, we've now entered surgical land. So
what we did was we saw and we started him on finasteride, and he's happy with that. So he's on finasteride. He's taking 1 milligram 3 times per week, and is not having any issues with that. Okay, and he's generally happy. Now, the other thing I want to mention is this is perfectly normal. Yes. This is an absolutely normal hairline. The issue is that he's come and said, okay, I agree this is part of, you know, aging, but I'm not happy with the density I've got there or the shape of my hairline. And the thing is that with medical therapy alone, you are not going to change that shape. Like Russell said, at best, you can thicken up a little bit in the frontal hairline.
Okay, so then if we've discussed that part of it, and now he's really keen to talk about what happens around the hairline, this is where we start to get talking turkey about surgery, right? What surgery can do for you. And I want to emphasize to you, because this is a mild degree of hair loss, that our goal is to make him look less bald, not to make him look 16. All right, so we're not going to give him a hairline that looks like Jamie Foxx across here like this, right? Or Brad Pitt with a hairline down here. That isn't going to happen. You know, it just isn't right to do this. So the other thing to remember, the second thing is that on the face, everything works in curves, okay? Your wrinkles are curved, your eyebrows are curved, your hairline's curved. So whatever design that you want to think about when you reshape your hairline, do not think it's going to have a straight line. That draws your attention to it. The idea of calling it a hairline is a bit of a misnomer because really it's a hair zone. All right, so if we look at this area here, what we'd say to him, okay, we're going to come off this point here and we have to find a point on the side, but we want to make you look less bald, so we might look at a connection point up here and we might draw something along here like this, okay? That might be the kind of line that you would draw in someone like him. So there's a bit of recession there. That point is higher than that point. That's what I'm trying to say in English. This point is higher than this.
So
point.
just to demonstrate on that, on this view, is that we're not coming across that way. We're sort of bringing it up and curving it round there.
Correct.
And that's probably the most aggressive that we'd want to be in that.
So it has to be curved, and this point has to be higher than this point. And then you fill in behind that point. Now, the point is
why don't you want to make it, I mean, flat? Because he's 36 and he's gone, you know, I remember the glory days when I had this, or I've seen Brad Pitt and he's got a flat hairline. What's the problem with me having a flat hairline?
Because he has progressive male pattern balding, okay? And so in other words, just because we put him on finasteride doesn't mean he's going to stay on it for the rest of his life. Just because we put him on finasteride doesn't mean he's not going to lose any more hair in the rest of his life. So the problem is, if we're in a progressive condition, we have to think about that. We have a limit to what we can eventually do. The more hair loss you have when you present young, the more conservative we're going to draw our hairlines, because if the rest of the hair becomes bald, we need to have some donor hair to deal with it. Okay? Less likely to be a problem with him at this stage. But the more aggressive the balding, the more the problem we have. And the other thing is, you want to be age appropriate.
That's right.
Okay, there are not many people that walk around with Brad Pitt hairlines. You might think that's a great idea, and the girls might think it's a great idea that you have a hairline like Brad Pitt, but it's a very rare thing indeed. So, you know, the idea is to make it less bald. And what we do with the patients is we don't just give them one line and say, hey, you know, this is all you're going to get. What we do is we start with one, we draw something, and we ask, would you be happy with that? And we don't start low, we start high, because sometimes patients surprise us and say, you know what, if you just took out that bit up there, I'd be happy. Right? So why over-treat something if the patient only wants a little bit of a fill-in? So we start high, let them have a talk about it, and then we negotiate something that might be acceptable. Now, if Vikram and I have a patient who is talking to us and asking for something down here or here, all right, that's a no. Okay,
we'll turn them down.
We will say no to them, because we're not going to create something that looks wrong in nature. It's something you have to wear for the rest of your life, and for us it's a tragedy if a patient has a surgery and then feels compelled to go into a laser hair removal place afterwards to get rid of some of the hairs because they hate where the position of the hairs is. That's a tragedy. We have not done our job if patients feel the need to reshape their hair with a laser. So we are by nature conservative. People get caught up in this idea that 5,000 grafts is required or 4,000 grafts is required. I mean, that might make sense from the clinic's business perspective. It makes no sense from looking after the patient. And the other thing is that when we put this triangle in here of hairs, just remember, if you lose more hair, you're going to lose it behind there, and you're going to get a GT stripe of baldness developing, which is an unnatural look. So, A, you'd better have been on, if you want to minimise the risk of this happening, you better have been on medication and stay on medication. Or B, you'd better be aware that if you lose more hair behind the grafts, which are going to survive because they're non-balding hairs, they are obeying a different set of genetic rules. If you're going to lose the hairs behind it going forward, you're going to have to come back for a top-up, because that's an unnatural pattern of balding.
So being conservative is actually, it's really important and really advantageous, because just to reiterate, you want to create the hairline that is age appropriate in his 30s, in his 50s, in his 90s. A flatter hairline is not going to look age appropriate in someone as the age.
Particularly if he has thinning in behind, because all of a sudden he's got a flat, low hairline of strong hairs with weaker hairs in behind. That does not exist in nature.
That's right. And also conservative, because you've got a plan. Even though this guy is 36 and hasn't lost a significant amount of hair for the last 2 or 3 years, we don't have a crystal ball. We don't know, is that the end of his balding? Because he may, for whatever reason, turn on his gene to lose more hair and lose more hair going forward. If he does, then we need to make sure that we've left enough donor hair to come back at a point further down the line. And so we have enough to be able to manage that and manage him in the long term. So if you get, you know, if you're in a situation where you're looking at changing a hairline and having a hair restoration surgery, and you get people that are sort of pushing high numbers of grafts, have a think about it, because being conservative is probably advantageous in the long run.
It is a myth to think that balding stops at 40 or 50. That is a myth. Okay, I've seen patients that didn't lose much hair like this till they're 40 and then lost a lot between 40 and 50. That can happen. There are some people, obviously, that have hair loss that goes to a certain area and stops. But we can't predict this. We have no positive way, and it doesn't matter about family history. My father, bald. My older brother, bald. Me, not bald, on no treatment. Okay, we don't know what's going to happen down the track. And men in particular and women are living longer than ever. All right, so he's 36. The way things are going, he's going to live to 86. That's 50 years. He's 18 years after puberty, not 58 years after puberty. So we have to think about the consequences. If our patients are going to get older, maybe they're going to get balder. Some of them don't, but some of them do. When people say, well, when does balding stop? I say, well, technically when you die. So basically, this is the thing that we have to keep in the back of our mind. It's a progressive condition, and you know, we don't have a way of increasing the numbers on the head yet.
That's right.
Okay, we are dealing with a fixed and diminishing number of hairs on the head, because as we age, we have less hairs on our head anyway. So even in our donor area, at 70, we have less hairs on the back of our head than we had at 40, even if we haven't operated. So we have to be cautious.
And if this person was in their 20s, for example, was not 36, say it was, 22, 23, we'd be even more conservative. We would be pushing almost to say, right, well, let's see how you go for as many years as possible with medical therapy,
with medication.
and see how things progress. I mean, the number of people, I'm sure you get this as well, the number of people that come to me and go, listen, it's just, now is the most important time of my life. If I just get it now, I don't care if I'm bald when I'm 40
I'll
or
shave
50.
it off.
I'll shave it off. And then my answer to that is that you won't believe, I've never seen anyone who's come to see me at that 40-year-old mark and gone, I'm fine to bald now. Everyone cares at that point. We just moved the goalpost. Everyone still cares. So it's not time dependent. So I think the underlying message that we've got is, yes, but be conservative about what your expectation and how you manage things.
So I hope this has helped explain to you how we would normally start a consultation, and then we let the people go away and think about the information we've given them, right? You do not want to be in a high pressure sales situation where people are putting pressure on you to make a decision on the day of a consultation. These are complicated matters. They require commitment, both medically and surgically going forward. You need to have a very clear think about what it is that you're really prepared to do in future compared to what you're prepared to do today. You want to talk with your loved ones about it and get some feedback from those as well. So, do not get into a high pressure sales environment and live to regret making a snap decision. Yeah. Think about it very carefully.
You should and I always feel somewhat uncomfortable, unless someone's done a lot of research before they come and see me and gone, look, I know exactly where I am and what I want to do. If someone says, I really, let's book in and let's have surgery at the earliest point, I say, have a think about it. Make sure that you're doing the right thing, because the hairline that we're going to leave you with is, you're going to be left with that for life. All right. So be mindful of that and keep that in the back of your mind when you're deciding what's going on.
I hope these mock consultations help you understand how you should really expect a consultation to go if you're going to go and see somebody, right? It should be about what your options are. These are the outcomes that you could expect, but these are the things that we'll commit to going forward, further surgery or further medication. And then make sure that person or clinic let you go away to think about things, because you cannot make a snap decision about this ordinarily and necessarily make the best decision. I hope this has been a big benefit to you today. We've enjoyed talking to you yet again, and we look forward to talking on the next episode.
Perfect. And also, just reiterating what we said before, if you are in the Melbourne area and want to come in and happy to be videotaped for a live patient demonstration, we will put the email address for the clinic in the link below, in the description below. So feel free to contact us on that. We shoot once a month on a Monday night, and so we'd love to have you there. So I hope you find that useful, and we'll see you next time.
Bye.